Okay, so we're just waiting for a few more people to join. If no one else jumps on, that's no problem at all. We'll carry on.
Yeah.
Just to introduce you to what we're doing here. So obviously the COVID situation has been quite bad, very impactful on a lot of businesses. However, if you're keeping up with the news, you'll start to see that there is now light at the end of the tunnel. So what we're doing, Sarah and I, are putting together a series of webinars to help businesses of all sizes, all shapes or regions, to essentially come back to work in a safe way. Because one of the things we want to avoid is, you put all this work in to get back to work, and then something goes wrong and it completely undoes it. So just to go through a few house rules, you can ask questions at any time, and we'll come to it at the end of the webinar. So if you do have a question, just click on the Q&A section and we'll be able to answer that for you. We're also recording this as well, so a lot of people aren't able to make it today, so we're going to record it and then send it out to everyone. You will obviously get a recording of this at the end as well. Give us a day or so and we'll be able to email it off to you. The slides are available as well, so if you needed to reference back to anything, you've got it all to hand. So again, if you do have any questions or you need to put your hands up, please feel free to do so. We're here for you, so we want to make this as interactive as possible. So first of all, I want to introduce ourselves. So my name's Lee, I run Mutual Recruitment. For 12 years, I worked in the finance industry, and I put together systems and processes to make everything run a lot smoother. So much so that I actually made myself redundant. So now I had to change a career, become a recruiter, and now I bring the honesty and accountability into the recruitment world. And I'm joined by Sarah Jane. Do you want to just introduce yourself, Sarah?
Yes, morning everybody. Yeah, I'm Sarah Jane Black, business owner for SP Business Services. Been a consultant since 2003 really, with my business as well as being employed, so doing double whammy really. So what do I basically do? Business consultancy, business support in a box really, planning and delivering solutions. That goes from assessment consultancy and compliance, so I'm an IQA and a qualified teacher and assessor. Also implementation of business policies and procedures, in-house training for any corporate company who wants it, accreditation information and things like ISO 9001. So yes, support in a box, that's me.
And I'm guessing with the COVID situation, it's keeping you very busy at the moment.
Very busy, especially with COVID planning under the health and safety, which is hopefully something that we're going to be covering a lot today to help those businesses out there go back to work safely.
Exactly, and I think that's what we're essentially here for. So just to run through the agenda with you guys, I'm going to talk a little bit about the current situation and the impact that it's had on not only businesses, but the staff within the business, because when you work within a business, the key resource that you have is people, and keeping them, happy and healthy is essentially the key to running any successful business. We're also going to run through practical solutions. So, the planning side, which is something that we can crack on with now, versus the implementation side, which is what's going to be coming over the next months as we slowly start to get our businesses back to life. And then at the end, we have a question and answer section. So if you did have any questions you wanted answering, again, put them in the question section, and we'll come around to it at the end. If we get quite a lot of questions, we can always personally answer them after the webinar. So why now? Essentially, as you would know, COVID has hit businesses really hard. We've come through about 3 months of next to no activity, but we are starting to see the light at the end of the tunnel. Now, the Chancellor of the Exchequer has laid out plans for a bit of flexibility in the furlough scheme. So come the 1st of July, the big changes are that you can now start to get staff back to work and pay them on a pro rata basis. What that means is, for example, if you needed someone to come back 2 days a week, you can pay them for those 2 days, and then the government will pay the balance, so the other 3 days, through the furlough scheme. And that will have a real big impact on getting people back to work. It really incentivizes managers to get their team back to really access that skills that they've got there already. And then that's all leading up to the end of October, where the furlough scheme will end. So all of the support that you're getting, all of the staff that you are putting on furlough, without the furlough in place, it's going to be real tricky to start up everything, at such short notice. So what we've put together is, a way how you can do that in a safe way. So as you know, the current situation, it's had a real impact on everyone's lives. Unfortunately, we've lost quite a lot of people through it, and their lives that we can never get back. And it's also had a big impact on businesses as well. Essentially, it's put the brakes on most businesses. Really putting them in hot water. And it's something that we need to start to plan to get out of while we still can. So in terms of what's changed, obviously the old way of working of 100 people in an office is going to be something impacted directly. And what that means is, from a survey that we did, 67% of businesses will start letting their employees work from home a lot more, which is hugely impactful on what everyone is sort of planning. And it's different to what we faced, especially for some of the older companies who are used to the way of working. And then half of all businesses will have a staggered approach. So as you could imagine, it's not a good idea to, on day one, get everyone back in the office. So a lot of businesses are adopting this approach of slowly, safely. But from an employee point of view, because this has had such an impact, many more people have sort of seen that actually they can start doing their work from home. So 70% of the people that we've quizzed, they would say going forward, they would ask to work at least one day from home once everything returns back to normal. And it's actually had an impact on how people view the benefits of a business. So now 61% have said that they would either leave a business if they don't offer flexibility, or they wouldn't consider working for them. So that's had an impact on, when you're hiring people, you sort of lock yourself out to a huge selection of the talent pool if you're not able to, adjust to the new way of working. So at the moment we're at a bit of a crossroads. You can either sort of look at it as, everything's gone bad, I'm going to, stick my head in the sand, not plan for everything, just sort of be guided by the government. Or you can realize that everything's going to get back to normal eventually, and you can start to put in plan, ways to get people back safely, ways to continue business so it doesn't have a massive impact. And if you think of it as you're sitting in a traffic jam, I know it's something that everyone's been missing working from home, but if you think of it as you're in a traffic jam, if you move too quickly, you're going to either stall your car or you're going to hit the person in front of you. If you take your time and do it too late or too slowly, other people are going to pass you by, and you risk a lot of, in all honesty, if you can't fulfill your contract with clients, they go to someone who can. So what we're aiming to do is give you the tools to get back to normal. So first stage is planning, and this is with any sort of big project. Planning is key, and this is what I'm going to cover in my section, is sort of how to set the stage for how you can come back to normality in a way that is good for not only the business, but also good for your staff members. And then Sarah's going to go through some of the implementation. So some actual physical, tangible things that you can start to do to get the ball rolling, to get people back into work safely. And then if done correctly, this will lead back to the normality of not quite the way things used to be, but something that looks quite similar.
And I personally think it will be more positive and a better flexible way of working for everybody. So
Yes, I agree. I think for all the bad that the COVID situation has caused, it has it's almost forced businesses to reevaluate the way they
yeah,
work. And
yeah,
technology has been around for quite a while, but there's not always a massive adoption of the technology.
no, I agree.
Especially in the accounting world where I'm previously from, you'll be surprised at how many businesses still run on paper copies and Excel.
Yeah,
So it's really about bringing you into a safe environment, but working from the point of view of what we've got to deal with now.
yeah,
And the underpinning thing of this is communication. So whatever decisions you make, you have to remember that these are impacting people's lives. So a back and forth communication is always better than someone making decisions from afar without any input from anyone.
yeah,
So what we recommend is a holistic approach. No team is a silo, no one is an island. So every sort of impact, so everything will be impacting another department. For example, if HR decide that everyone has to work from home, there's going to be a financial cost of buying everyone equipment, making sure everyone's homes are set up correctly. There's also going to be an impact on IT. So, installing the software, making sure that everything is up and running, making sure that you can communicate with everyone else. And also, for example, sales, a lot of the teams might work better in a team environment rather than individuals sitting at home. So it all depends on, the business, how your business works and how you can sort of function as a team. But the key thing to remember is this does impact the whole business, not just a single aspect of it. So the reason why planning is so vital is at the moment you have an issue with supply. So you have employees which are furloughed at the moment, and it's a case of what can we do to bring them back in, and again, what is there for them to do. So, if you've got 100 members of staff, it might be a case of only half of them can come back. And then it's deciding out of those half of staff, what can they do? What work is available for them, which ones need to come back and when, and then which ones need to be in the office at any sort of given time. So going back to the example of sales, they might work really well in a team environment. However, accounts might not necessarily need to be in the office to productively do their work. And then there's the impact it has on teams. So if you're running a sales team, but also a sales support team, they need to be in communication with each other. So it all depends on what's available, and what you actually need to do as a business to sort of get on with it. Now, from the aspect of employees, you'll have you'll have a list of employees, but each employee has their own different circumstances. And when planning who you're going to get back, it's key to sort of evaluate their current situation, their current thoughts and fears, and what essentially is preventing them from coming back to work. So, they could have safety issues. They might have lost someone to COVID, or they might be in the at-risk category, so they might not necessarily want to come back to work. There might be travel issues. So if someone lives 45 minutes bus journey away, they might not be able to get the bus because it's not running, or they just might not feel safe about getting the bus. And again, a key thing to remember is although some of the schools are going back this week, over half of them won't be going back, especially till after September. So these are all key things that you need to consider when you're considering the occupancy and capacity of your office. And what we recommend is asking your staff. It sounds simple and sort of a no-brainer, but asking your staff how they feel, ask them what are their fears, what would they like to see in the office, how can we do it in such a way that actually keeps them happy. There's obviously going to be a lot of change in the working environment, that's unavoidable, but really managing their concerns, managing how they feel about it is really the key to success here, because they are, you know, the cogs that work in the machine that is your business.
Yeah.
So once you have a bit of an idea of who can come back to work, and you know who would rather sort of stay at home, or you know who actually has decided that they don't want to return at all, you can then look at what you're going to use your office for. Now, the office is going to become a finite resource, especially with social distancing in place. You're not going to be able to fit everyone back in as you would like. So it's key to really plan who comes back when, you know, what can we do to avoid people coming back to work unless it's absolutely necessary, and you know, what will the office look like in the future. One of the things that we recommend is, if you can, zone off your areas, and then look at, you know, who needs to come in on what specific days. So for example, if your company finds that sales happen sort of more often Monday to Wednesday, it makes sense to get sales in on those days. Whereas if, you know, Friday is the day that all the invoices go out, or, you know, payroll is done, then obviously finance would need to be in. So it's all about sharing the space, but also creating mini silos within the space that you've got to, you know, eliminate risks and, you know, make it a lot safer for everyone involved.
Yeah, and you, on that note, you do need to make sure that it's no more than 10 people in one space. I will talk about it in more. Also, on that note, when you've got those people in place on those particular days, you must keep a log, a contact log. This is basically to help you facilitate contact tracing, which, just in case anyone got COVID symptoms at any time. So although I'll go through it in more detail in a minute, while we're talking about it, it's really important that you know that you have to have that log in place.
Yeah, so I think if you can, you know, manage the staff in a good way, but also, you know, it's because the office is a resource and it is limited. It's about what can be most effective and when.
Yeah.
But from a you know, a personal point of view, you don't want to set the office in a way that it actually looks like a prison, or, you know, a quarantine camp that you see in horror movies. This is where people come to work. It's, you know, where a lot of people make friends and, you know, sort of live their lives. So what you want to do is do it in such a way that you still keep the sort of essence of your business, and you remind your staff of why they actually come to work for you versus your competitors. And what you have to remember is everyone has a different perspective of the virus. You could have people who have had mild symptoms in the beginning, but then, you know, don't really see the point of queuing for 4 hours just to go to Tesco's. Or you could have someone who has sadly lost a parent or a loved one to this disease. So it's all about, you know, keeping the right balance of safely working, but in a way that doesn't, you know, scare your members of staff.
Yeah, I agree. It's about that collective approach, isn't it? And I think supporting your staff throughout this to reduce any anxieties, because I do feel that we will find people who are in that circle of mental health and have been before COVID, but people have become more anxious because of this. So we do have to look at the you know, the mental health side of it. I know last week was Mental Health Awareness Week. So if there are any companies that do have occupational health service as part of their employment provision, then providing information to employees about that and giving them support advice publicly is really important too.
Yeah, exactly. Keep the staff in mind, I think, whenever you make the decisions. So that's essentially, you know, a good way to go about planning it. Plan it as if it was sort of any resource in your business. So, you know, making sure you know what your actual demand is, and, you know, what you can actually meet is sort of key to it. But then, you know, add the human side, that actually this is people's lives. This is, you know, a lot of people see their identity as their job. So, you know, a lot of people are keen to, you know, return to work, but in a safe way.
Yeah, definitely. Definitely. The safety is the key aspect here, and the key concern is the return to work plan, I think.
Yeah. So Sarah, because you're an expert in the health and safety arena,
Yeah.
what I'm going to do is I'm going to hand over to you to
Yeah.
walk through what people can actually do, implement from today.
Yeah, lovely. So I'm going to go through basically the implementation phase, and as an employer, what you need to be doing. Every business has to decide, like we've discussed, on who comes back and when they come back. The key concern of all of that is the health and safety of the employees, and that will go alongside with taking into account existing obligations under health and safety law. So yes, you need to keep up to date with measures introduced by the government and rise accordingly. The HSE will be doing spot checks, and so they still implement inspection powers and the power to issue enforcement notices, improvement notices, or prohibition notices. And with that still comes the penalties of breaches of health and safety obligations. So this is where getting it right first time is crucial to your business as well as to your staff. Developing a COVID response plan is the way to be going. This is not a generic risk assessment. There is no such thing as a generic risk assessment out there, because every time we go to work, every day is different. It could be different with the people who are surrounding you. It could be different with the work you're doing, and your safe system of work. And it also could be different from the environment that you're in. So let me just talk about one of your first things is to appoint a worker. So appoint someone who is in the organisation under health and safety or HR or a manager to become the COVID response person, the worker representative really. That will depend on how many people you've got in your business as to how many representatives you will need. It's kind of working on the ratio 1 to 20 really. Each of these representatives must have training, COVID training, and be given a framework to work by. That COVID training I can help and support them with, so that they know what to put in place around the workplace and what advice and information to be able to give to employees. Crucial again, you have to decide whether it's essential. You have to decide whether a person can remain at home or whether it's essential for them to come into work. Is it safe to come into work, which means we have to look at the journey into work, the journey home, sharing vehicles, etc. We try and eliminate that if we can. The most important thing is elimination and reducing the risk. So if they're having to share a vehicle and there is not a way that you can reduce the number of people in that vehicle, then and the 2 metre distance isn't there, then you need to be applying PPE to those people to ensure that that is a safe environment to be in. So ensure faces and masks, etc. Along with that, once we've got your COVID plan and you've done your what I would class as a basic risk assessment, which will include all your key aspects of your business, you have to make sure that you have adequate procedures in place for identification and isolation of workers. So therefore, like I mentioned earlier, if you're having a group of people into work on a Monday, you need to keep a log of the group of that people so that they've got contact tracing if anyone does get any symptoms. The appointed person will be the person that is responsible if someone does have symptoms to remove them from the workplace, which is obviously confidential, and to provide a safe system for them to get to hospital, and then to advise the other people within the same group to isolate. Signage around your business. You must provide signage for hygiene. You must provide a process and procedure for hygiene for not just your employees but for visitors as well. So Signage around your business is crucial. It needs to be things like hand washing signs, your 2 meter distance signs and warning signs, help and advice signs, and the name of the person who's appointed to be their COVID representative. Think about other things like your physical distancing around the office and around your business. This must be crucial. Distancing across all work activities. So looking at changing and reviewing all your policies and company policies, like your sick policy, your absentee policy. Introduce a no handshaking policy. On the hygiene, make sure that people are cleaning their desks and their keyboards on a daily basis. Look at cleaning before you go back to work. It is totally advisory for all offices to have a deep clean before they go back to work. Then you're starting a clean slate. PPE is very high in the COVID. However, under general risk assessment and health and safety, it has to be a last resort. If you can eliminate something first, then you must eliminate. If that means a group of 5 people, like we said, don't need to work in the office, then leave them and make sure they can work at home safely.
And I guess it, Sarah, I guess it, if you're in an office environment and you're surrounded by, people wearing masks, it's not really a very inviting environment. And, if you're trying to sell on the phone, for example, it'll be hard to communicate with people.
It will, and that's why it's far better for the business itself to rotate your staff. Have 3 in who are working in separate rooms, or they can do the 2 meter distance and then get another 3 in. What I will say is, with all of this remote working, and I've kind of suffered this recently, and that is the person who's working at home can't be eliminated from information and communication, because they will feel they're still part of a team and they're still crucial to your business, and you still must make sure that the communication with them is on a regular basis. And when I say face-to-face, I mean on FaceTime or on a Zoom meeting, because none of us can go forward in business if we're doing it alone. It has to be a collective.
Yeah, exactly. I think this sort of goes back down to the staff returning, really. It's, it has to involve them at every point.
Does. They have to be informed all the time. And this is where what they call the issue of pre-return to work form is a mandatory requirement of a COVID plan, which means that a form has to be generated by the business. I can also help with that, and sent out to all employees who are going to be coming back into the workplace, which will basically have specific questions about: have they been diagnosed with COVID while they've been furloughed? Have they experienced symptoms? Were they in close contact with an affected person? Have they been advised by their doctor to isolate? And to inform that obviously there will be temperature testing. Under Public Health England, they are advising temperature testing at work. So all of those things have to be implemented within this pre-return to work form. Now, that return to work form must go out to all employees. It should be completed and returned by all workers at least 3 days before they return to work. So with this sort of the next graduation of 2 to 4 weeks that we've got, this is the time to start doing that form and getting it out there.
And is this something that they can set up online if they have an intranet, or does it have to go through official channels?
They can do it by internet, but the employee has to make sure that they are informed and that they've answered all the questions on the form and returned it in that time, because within that 3-day time limit, then it helps the rest of the areas of the business and management teams to decide who can come back to work and who can't, and on their rotated scheduled basis.
Okay, and with the return to work form, what are the consequences if it's not done correctly or not done at all?
Unfortunately, like I said right at the beginning, it will have consequences, because what you're doing is, if you're not sending that form out, you are not evaluating your risk. It is part of your risk assessment. It is part of, basically, you're identifying the risks of every individual that comes into the workplace. If that isn't done, then you could have an employee who you quite willingly wants to come back to work. He comes back to work full time. They're with another group of people. You don't know what that impact is on that group of people or that person. If they've been in any way implemented with COVID, anyway, it might be mild symptoms, you know, that another person in the household might have it. That increases the risk. Therefore, you have not done everything reasonably practical to reduce the risk and make going back to work safe. Therefore, you are under HSE as managing health and safety, and you will not be compliant to the Health and Safety at Work Act. Therefore, you'll end up with either a fine or an enforcement notice, which will put added pressure onto the business.
Yeah, which is something that they could really do about at this time.
Exactly.
And so with the prevention and control measures, can you do it like a fire drill? Can you preempt it? Can you get everyone involved? How do you suggest it sort of?
Right, well, the actual response plan has to be a collective. So like you quite rightly said earlier, Lee, about going out to employees with questionnaires and polls and asking them, has to be a collective with all of them. So you can put your foundations for your plan in, but that plan has to go out to not just your employees, but has to go out to your supply chain. Because within that plan, you have to make a system for recording visits to your workplace. And that's not just your employees coming back to work. That might be delivery people. You know, you might find that you cannot do a meeting remotely and someone has to come into your workplace. They have to know what your response plan is. So getting everyone involved is absolutely crucial to getting a collective response, really. The appointed COVID representative is the person that would lead the plan. Obviously, the training and information would come to them. They would then have to disseminate that to employees, which then comes the pre-return to work form. Obviously, reviewing policies. You need to do reviewing policies as part of your plan, like you mentioned before. But throughout all of this, everything has to be communicated to your employees.
Yeah,
right? They have to agree.
Yeah, exactly. It's sort of, you know, they're as much involved as sort of anyone else, and
yeah,
you don't want to have you know, a nasty shock in what is currently an unprecedented time and immense stress on everyone.
It is, and there's a lot of more anxiety levels are higher throughout, you know, and all you're trying to do for your business and for your employees who are key to your business, because without them we don't really have businesses, as we know. Most important thing is to ensure your organisation operates in an inclusive culture, so that every employee feels they are returning to a safe, supportive and caring environment. And not just those employees, but all of your supply chain, so that they know that you're having a collaborative approach and doing things right.
And is there any specifics that an employer has to do with regards to supporting an employee? Do they have to offer, you know, counselling if they've been affected by it, or, you know?
If a company has a service in place, then they use that service. A lot of companies might have, you know, occupational health service, then bring that service in. That's what they're paying for, then use that. If not, then HR need to be strongly involved, health and safety need to be strongly involved in that response, along with the appointed representative. They need to be able to put signage up throughout the offices to say what support is out there. So to give the web addresses for charities that can help, okay? To have one-to-one meetings if necessary to dispel any concerns and anxieties. And those sort of questions would be placed in the pre-return to work form, and then HR and health and safety and the appointed representative can then evaluate those answers and decide whether this person does need some support. You really do have to support your staff throughout this. You know, you might have someone who turns out to be a vulnerable worker. They might have underlying health conditions, but it might be that they cannot work from home and it's essential that they come in. Well, it's absolutely crucial to that staff member that they're supported and do maintain a physical distance of 2 meters all of the time. So it might mean they have to move into a different office. They might, you know, they might have to come in on a separate day to somebody else. So I think your pre-return to work form and your check with all your employees is one of your first things to be doing, because then it will identify where the gaps are and how you can then plan your environment of working around it and around each employee.
Yeah, and I think the key thing to remember is, you know, this is a temporary measure in a way to you know, make sure everyone comes back and you know, everyone comes back safely. And you know, it won't be long before things do return to some form of normality. Obviously, it won't be exactly the same as what it was, but I think with, you know, a lot of impactful things that happen, we live and we adapt, and you know, we get sort of some form of normality back. And you know, in a few years time, you know, working from home 3 days a week might be the norm. It might be a case of we no longer need, you know, massive offices to, you know, work from, because we're actually more agile and more remote
and more creative. Because I think throughout all of this, you know, you have to look at some positive sides of this, and we have had to find different solutions to the ways that we work. And I think that, you know, collectively, that's why one of the biggest, not drawbacks, but one of the biggest parts of business is going back to work now is a lot of people will find that actually they're quite happy and more creative and more productive at home. So how do we get them back to work? And I think that that goes back to being a collective response and speaking to all of your employees and asking what do they want, because then when everyone is working, whether they are going to be working at home or in the office or a mixture of the two, then they will feel that they're in a caring environment and still want to work with you.
Yeah, and I agree, that's key, and a lot of it is driven by the wants and needs of, you know, the staff. So for example, people who are key workers who are working from home, they might be finding it difficult to separate, you know, work and life balance. And you know, if they're working up at their kitchen table, they might still be thinking about, you know, work when they're sitting down and having their dinner. Alternatively, you know, you've got people who they bounce off of the office environment, especially in you know, team spaces. You know, they might feel a bit lost working from home and, you know, itching to get back into the office.
And that's when it's key communication. You know, just because these people are at home and they're still working, they're still part of the team, you know, keep in contact with those people. That's absolutely crucial.
And so I think now is the key time to get that ball rolling. If you haven't spoken to your staff in a couple of weeks, it's crucial that with the, you know, changes in, you know, the beginning of January and the beginning of July, and then the end of the furlough scheme in October, I think a lot of members of staff who haven't received any sort of communication are sitting there, you know, essentially worried for their job.
I'm wondering why, you know, their anxieties will naturally rise, and then they will also then feel quite devalued if they haven't had that communication, and therefore, you know, they will start looking elsewhere, and we don't want them to do that.
You don't want to lose your best accountant or your best salesman because, you know, you haven't communicated. And you know, a phenomenon that I'm seeing as well with you know, candidates is that they're getting furlough envy. So they're sitting there wondering why, you know, they weren't essentially good enough to be kept on, whereas the person that they used to sit next to was allowed to carry on.
Yeah.
But even vice versa, I'm sure there's people out there who haven't been furloughed, but are wishing they had a good couple of weeks where they didn't have to think about work.
Yes, and I think that that though all of those feelings, good, bad, or indifferent from either side, have to be looked at, have to be addressed, and everyone needs to be made to feel totally equal and valued throughout. I think that's
Yeah.
essential to going forward.
Exactly. I'm really conscious of the time. I know we've been here for 40 minutes. So what I thought I'd do is go through to some of the questions that we've been asked. A lot of the questions have been answered on the webinar already, but I'll run through a few now. So we've been asked with regards to staff eating, is it better for them to sit in the communal kitchen and eat, or would it be better from a health and safety point of view to eat at their desks?
Okay, I would say in no way share a kitchen. There, you've still got to think of your 2-meter distancing. You've still got to consider going out and getting food if you wanted to do that. I would say that you need to be staggering the use of canteen time. Limit the amount of people if you are in that situation. If it's just a one kitchen for everybody in the offices, and the same as toilets and things like that, you've really got to consider distancing and massive hygiene. I wouldn't be sharing any kitchen utensils or cups or things like that. I'd ask staff to bring their own in.
Yeah.
I think if there's any places within your offices that social distancing isn't possible and it's not a crucial place for an activity, then I would just leave that room empty. Don't use it. Use it as an isolation room for someone who might get symptoms. But those are the things you really do need to consider. But no sharing of kitchen areas if at all possible.
Yeah. Okay. Speaking of sharing confined spaces, we've been asked, what's the best way to manage a lift? So if you're on the top floor, or people with accessibility issues, what would be the best way to manage the lift in that situation?
Again, you have your 2-meter social distancing to consider. They do say that you can go down to 1 meter, but then you might have to be considering wearing PPE in that 1 meter, because you're not in the lift for a great deal of time. It is minutes. If you can rotate that usage, in other words, employees who have got disabilities or are vulnerable in their mobility, I'd ask them to use the lifts, and perhaps the more active use the staircase. Again, under staircase and stairwells, you've still got to make sure that there's social distancing. And I will say the other thing is, those sort of things need to be wiped down regularly. Handles, that still has to be put in place, and walkways where you are going to be placing your hands.
So be conscious of where you're touching and the air that you're breathing in.
The hand washing and the hygiene rules still have to be in place. At the end of the day, this is about self-hygiene. It's about everyone working together, and employees know what their responsibilities are. But if there's something that is specific to the workplace, then it's down to the COVID team to inform the staff.
Fantastic. We've been asked, what are the responsibilities for people working from home? So basically, from an accounting point of view, I think at the very minimum you could contribute towards the internet and phone costs. But does an employer have to ensure that there's an ergonomic space for them to be working from, that they're taking the regular breaks?
Health and safety is about being responsible for yourself and others. Working from home, it's up to the employer to provide the employee with a display risk assessment, which they can get off the HSE website, get the employee to complete that so that they know that they're using the right equipment at the right height, sitting in the right chair. Otherwise, and also working times, so that they should know once they've done this risk assessment that they can't be at a computer for more than an hour without coming away and having a break. But to ensure that every employee who's working at home completes one of those risk assessments and they've signed it, the employer has been reasonably practical and complied to health and safety. Then the rest of it is down to common sense of that employee at home.
Yeah, fantastic. And last question that we've got, or that we can sort of manage. Don't worry if you haven't had your question answered. We will be sort of reviewing them at the end to give you a personal response. But we've been asked, if someone does contract COVID, what are the rules around letting the team know? Does it have to be confidential, or can an employer inform someone in their team has had or is currently suffering with COVID?
It does need to remain confidential, insofar as it's not an open forum. You know, the person who's having symptoms goes and tells the appointed COVID representative or their manager or HR. They don't collectively go out and tell the world. It does have to be confident, but at the same time, people will need to be informed. Okay, but once that person has been taken out of the workplace, and that is down to the response plan, down to the appointed representative. You have to have an isolation area. You have to make sure all of those people within that group who've been in contact, where the contact log comes in, all of those people have been informed and told that they go home, they self-isolate. And the person with the symptoms is then taken safely and securely off-site and to the hospital for the tests.
Yeah, I guess, you know, the whole point of this webinar is to give people practical ways to, you know, mitigate that risk to such a big level. So I think essentially prevention is better than cure in most cases.
Yeah, definitely. Yeah.
Fantastic. So I'd like to thank everyone for joining us on the webinar. Like I said, I'm quite conscious of time. I didn't want it to overrun too long. So thank you for sticking with us. So if anyone would like further information, what's the best way to either get it sort of online or contact you directly?
Contact me directly. You've got a couple of ways of contacting me. You can phone and text my number, which is 07897 441774. Email me, which is sbbusiness27@gmail.com. Find me on LinkedIn. I'm Sarah Jane Black on LinkedIn. I've also got a Facebook page, which is SB Business Services. So quite a few ways to get hold of me.
Fantastic, and I'll make sure that those details go in the email. So like I say, thank you very much for joining us today. Give us about a day or so and we'll have the recording and the slides sent out to you. If you did have a question that we weren't able to answer on the webinar, don't fret, because we do see them all afterwards, so we'll be able to get in contact with you for specific concerns. And I think that the key thing to remember is, you know, if you have a safe workforce and a happy workforce, you'll be a lot more productive.
Yeah, definitely.
Fantastic. So I'll let you guys sort of get on with your day, but I wish you guys a very safe journey.
Thank you very much for attending, everyone.
Thanks, everyone. Have a